Question 1. A licensed practical nurse, LPN, is caring for a client with a new colostomy. The client is visibly upset and refuses to look at the stoma. Which action is most appropriate for the LPN to take? A. Reassure the client that they will get used to it and leave the room to allow privacy. B. Demonstrate how to empty the colostomy bag and change the wafer. C. Contact the primary nurse or charge nurse to request to consult with an ostomy nurse. D. Inform the client that refusing care will delay their discharge. Answer: C. Contact the primary nurse or charge nurse to request to consult with an ostomy nurse. The concept tested here is interprofessional collaboration and recognizing when to escalate care or make a referral. The client's refusal to look at the stoma indicates a need for specialized emotional and educational support beyond the LPN's scope or typical patient teaching for a new ostomy. While the LPN can reinforce teaching, a highly specialized issue like this often requires an expert, such as an ostomy nurse, who can provide comprehensive education, emotional support, and strategies for adjustment. Requesting a consult ensures the client receives the most appropriate, holistic care from the right professional, promoting better adaptation and outcomes. Question 2. A client scheduled for a colonoscopy expresses anxiety about the procedure and states, "I'm not sure I want to do this." The LPN has already reviewed the procedure with the client. What is the LPN's best next action? A. Reiterate the benefits of the colonoscopy and encourage the client to proceed. B. Document the client's refusal and notify the healthcare provider. C. Ask the client what specific concerns they have about the procedure. D. Administer a prescribed anxiolytic medication to help calm the client. Answer: C. Ask the client what specific concerns they have about the procedure. This question tests the LPN's understanding of patient advocacy and communication within the scope of practice regarding informed consent. The keyword "best next action" suggests a need for further assessment before making a decision. Before notifying the provider or administering medication, the LPN should first explore the client's specific concerns to understand the root cause of their anxiety and potential hesitancy. This allows the LPN to provide targeted information or clarification, or to determine if the client truly wishes to withdraw consent, ensuring the client's autonomy is respected. Question 3. An LPN is preparing a client for discharge after a stroke. The client lives alone and has significant weakness on their left side. Which resource is most important for the LPN to discuss with the client and family during discharge planning? A. Outpatient physical therapy schedule. B. Availability of a home health aide. C. Community support groups for stroke survivors. D. Instructions on medication management. Answer: B. Availability of a home health aide. This question emphasizes coordinated care, specifically discharge planning and resource management for client safety. The keywords "lives alone" and "significant weakness on their left side" highlight a crucial safety concern regarding activities of daily living, ADLs, upon discharge. While all options are important, a home health aide directly addresses the immediate need for assistance with personal care and mobility in the home, which is paramount for a client with significant weakness living alone to prevent falls and ensure basic needs are met. This ensures safe transition and continued well-being. Question 4. An LPN is providing care for a client who is non-ambulatory and requires frequent repositioning to prevent pressure injuries. The LPN has delegated turning the client every 2 hours to the unlicensed assistive personnel, UAP. Which action by the LPN demonstrates appropriate supervision? A. Asking the UAP if they have repositioned the client. B. Independently checking the client's skin and position every 2 hours. C. Reviewing the UAP's documentation of client repositioning at the end of the shift. D. delegating the assessment of skin integrity to the UAP. Answer B. Independently checking the client's skin and position every 2 hours. This question tests the LPN's understanding of supervision and accountability in delegation, a key component of coordinated care. While LPNs can delegate stable tasks like repositioning, the LPN retains responsibility for the outcome and must verify that the task was performed correctly and safely. Independently checking the client's skin and position ensures the LPN is actively monitoring the client's condition and the effectiveness of the delegated task, proactively preventing complications like pressure injuries. This active verification is a core aspect of LPN supervision. Question 5. An LPN is caring for a client with diabetes who is scheduled for discharge. The client is struggling to understand how to administer insulin injections. The LPN has reviewed the teaching several times, but the client still appears confused. What is the most appropriate action for the LPN to take? A. Cancel the discharge until the client demonstrates proficiency. B. Document the client's lack of understanding and proceed with discharge. C. Notify the registered nurse, RN, to reevaluate the teaching plan and assess for barriers to learning. D. Provide the client with a pamphlet about insulin administration and encourage self-study at home. Answer C. Notify the registered nurse, RN, to reevaluate the teaching plan and assess for barriers to learning. This question addresses the LPN's role in coordinated care, specifically collaboration and recognizing the need for escalation when patient education is ineffective. The keyword struggling to understand despite repeated teaching indicates a barrier that might require a different approach or a more comprehensive assessment by an RN, who has a broader scope in patient education and assessment. The RN can assess for cognitive deficits, literacy issues, cultural barriers, or a need for different teaching methods, ensuring the client is safe and competent before discharge. This collaborative approach ensures optimal patient outcomes. Question 6. A client with a terminal illness expresses to the LPN a wish to stop all medical treatments, including their current palliative chemotherapy. The client's family insists that the treatments continue. What ethical principle should guide the LPN's action? A. Beneficence, acting in the client's best interest. B. Non-maleficence, doing no harm. C. Autonomy, respecting the client's right to make decisions. D. Justice, fairness in resource allocation. Answer C. Autonomy, respecting the client's right to make decisions. This question tests the LPN's understanding of fundamental ethical principles, particularly autonomy, in coordinated care. The core concept is respecting the client's self-determination regarding their healthcare decisions. The client's explicit wish to stop treatments, even if it contradicts the family's desires, must be honored as long as the client is deemed competent to make their own choices. The LPN's role is to advocate for the client's wishes, which aligns with the principle of autonomy, and facilitate communication with the healthcare team to ensure those wishes are respected. Question 7. An LPN is assisting with the admission of a client who reports domestic violence. The client states, "Please don't tell anyone, especially my partner." Which action is the most appropriate for the LPN? A. Reassure the client that their information will be kept confidential and document the report in a private note. B. Immediately report the domestic violence to the police as mandated by law. C. Inform the client that the healthcare team must be made aware to ensure their safety and offer resources. D. Discuss the report only with the primary registered nurse, RN, for further guidance. Answer C. Inform the client that the healthcare team must be made aware to ensure their safety and offer resources. This question focuses on the LPN's role in coordinated care, specifically patient advocacy and legal/ethical responsibilities regarding mandatory reporting and safety. While client confidentiality is important, safety is paramount, and domestic violence often falls under mandatory reporting guidelines or requires interdisciplinary intervention. The LPN should inform the client that the healthcare team needs to be aware to ensure their safety and provide appropriate resources and support, such as social work or counseling. This approach balances confidentiality with the immediate need to ensure the client's well-being and connect them with necessary support services. Question 8. An LPN is assisting with a new admission. The client has a history of opioid use disorder and is exhibiting signs of withdrawal. The healthcare provider has prescribed symptom management medications. Which action is the LPN's priority in coordinating care for this client? A. Educating the client about the long-term effects of opioid use. B. Administering the prescribed medications to manage withdrawal symptoms. C. Preparing the client for discharge planning to a rehabilitation facility. D. Notifying the social worker for a mental health consultation. Answer: B. Administering the prescribed medications to manage withdrawal symptoms. This question tests the LPN's prioritization skills in a coordinated care setting, focusing on immediate physiological needs. The keywords signs of withdrawal indicate an acute, potentially uncomfortable, and dangerous physiological response. Administering prescribed medications to manage these symptoms is the immediate priority to ensure the client's comfort, safety, and stability, as severe withdrawal can lead to complications. While other actions like education and discharge planning are important, they are secondary to addressing the acute physiological crisis. Question 9. A client receiving enteral nutrition via a gastrostomy tube develops severe diarrhea. The LPN notes the client's skin around the stoma appears reddened. Which action should the LPN prioritize? A. Apply a barrier cream around the stoma. B. Decrease the rate of the enteral feeding. C. Document the diarrhea and skin redness. D. Notify the registered nurse, RN, about the client's symptoms. Answer: D. Notify the registered nurse, RN, about the client's symptoms. This question assesses the LPN's judgment in recognizing when to escalate concerns to the RN within the coordinated care team. Severe diarrhea and reddened skin around the stoma indicate potential complications that require a comprehensive assessment and possible adjustment of the care plan. While applying barrier cream and documenting are important, the LPN's priority is to inform the RN, as they can assess for dehydration, electrolyte imbalance, infection, or the need to adjust the feeding formula or rate, which is beyond the LPN's independent scope. The RN's assessment guides further intervention to protect the client. Question 10. An LPN is working in a long-term care facility. A client with a history of falls frequently attempts to get out of bed unassisted, despite reminders and alarms. The LPN notes the client is becoming increasingly agitated when redirected. Which action best reflects a coordinated care approach? A. Apply wrist restraints to prevent the client from falling out of bed. B. Administer a PRN sedative to calm the client's agitation. C. Place the client in a wheelchair with a lap tray to keep them seated. D. Collaborate with the RN and interdisciplinary team to reassess the client's needs and develop alternative interventions. Answer: D. Collaborate with the RN and interdisciplinary team to reassess the client's needs and develop alternative interventions. This question tests the LPN's understanding of a holistic, coordinated care approach, especially in managing challenging behaviors and ensuring safety. The keywords frequently attempts to get out of bed unassisted, increasingly agitated when redirected, and best reflects a coordinated care approach highlight the need for a comprehensive, team-based strategy. Restraints and sedatives should be last resorts. collaborating with the RN, physical therapy, occupational therapy, and potentially a geriatric specialist ensures a thorough assessment of the root cause of the behavior, e.g., pain, unmet needs, delirium, and development of person-centered, less restrictive interventions, such as scheduled toileting, ambulation, or engagement activities. Question 11. A client is receiving intravenous fluids, and the LPN observes swelling and coolness at the fore-insertion site. The client reports pain. What is the LPN's most appropriate initial action? A. Apply a warm compress to the site. B. Notify the primary registered nurse, RN, immediately. C. Discontinue the fore infusion. D. Document the findings in the client's chart. Answer: C. Discontinue the fore infusion. This question assesses the LPN's immediate action in a coordinated care setting when an fore complication, likely infiltration, occurs. The keywords swelling and coolness at the fore insertion site and client reports pain are classic signs of fore infiltration. The most appropriate initial action to prevent further harm is to immediately discontinue the infusion, stopping the flow of fluid into the tissues. While notifying the RN and documenting are essential follow-up steps, the immediate priority is to remove the source of the problem, ensuring patient safety. Question 12. An LPN is assisting with the discharge of a client who underwent a knee replacement. The client expresses concern about managing stairs at home. What is the most appropriate LPN action in coordinating this client's discharge? A. Advise the client to avoid stairs until their follow-up appointment. B. Refer the client to an outpatient physical therapy clinic for stair training. C. Demonstrate proper stair climbing techniques using crutches or a walker. D. Contact the healthcare provider to request a home health physical therapy referral. Answer: D. Contact the healthcare provider to request a home health physical therapy referral. This question focuses on comprehensive discharge planning and resource management within coordinated care. The keyword managing stairs at home after a knee replacement indicates a specific functional challenge requiring specialized intervention for safety and independence. While general advice or outpatient therapy might be considered, directly contacting the healthcare provider to request a home health physical therapy referral is the most effective way for the LPN to advocate for the client's specific needs, ensuring they receive tailored, in-home support for safe mobility in their environment. Question 13. An LPN is assigned to care for a group of clients on a medical surgical unit. The LPN notes that one client's vital signs are stable, but the client is verbally aggressive towards staff and other clients. Which action is most appropriate for the LPN to take in coordinating care for this client? A. Reorient the client calmly and repeatedly. B. Request a security escort to remove the client from the common area. C. Document the behavior and continue routine care. D. Collaborate with the RN to assess for underlying causes and develop a behavioral management plan. Answer: D. Collaborate with the RN to assess for underlying causes and develop a behavioral management plan. This question tests the LPN's ability to collaborate and manage challenging behaviors within coordinated care, recognizing limits of scope. The keywords verbally aggressive and most appropriate suggest a need for a comprehensive and safe approach. While reorientation might be attempted, persistent aggression requires a deeper assessment to identify underlying causes like pain, delirium, or psychiatric issues, which is typically initiated by the RN. Collaborating with the RN and potentially other team members, e.g., social work, psychiatry, ensures a holistic assessment and the development of a structured, safe, and effective behavioral management plan, rather than reactive measures. Question 14. A client reports that their personal belongings, including a wedding ring, are missing from their hospital room. The LPN is unable to locate the items. What is the LPN's most appropriate action? A. Document the client's report in the electronic health record. B. Inform the client that the hospital is not responsible for lost personal items. C. Immediately notify the charge nurse or supervisor about the missing items. D. Conduct a thorough search of the client's room and bathroom. Answer: C. Immediately notify the charge nurse or supervisor about the missing items. This question addresses the LPN's responsibility in maintaining client safety and property and adherence to organizational policies within coordinated care. The keyword missing personal belongings, especially a valuable item, signals a potential security issue or a need for a formal investigation. While documentation and a room search are important, the LPN's most appropriate immediate action is to escalate the issue to the charge nurse or supervisor. This ensures that facility protocols for lost property are followed promptly, and an official investigation can be initiated if necessary, protecting both the client and the institution. Question 15. An LPN is observing a new unlicensed assistive personnel, UAP, bathing a client. The UAP uses extremely hot water and is not maintaining the client's privacy. What is the most appropriate action for the LPN? A. Report the UAP to the nurse manager after the shift. B. Immediately intervene by stopping the UAP and correcting their technique. C. Document the UAP's performance for their next evaluation. D. Ask the client if they are comfortable with the water temperature. Answer: B. Immediately intervene by stopping the UAP and correcting their technique. This question tests the LPN's critical role in supervision and ensuring patient safety within coordinated care. The keywords extremely hot water and not maintaining the client's privacy indicate immediate threats to client safety, burns, and dignity. The LPN has a professional responsibility to intervene directly and immediately to prevent harm. Delaying action, asking the client, or only reporting later puts the client at unnecessary risk. Direct correction ensures immediate safety and provides an opportunity for real-time education for the UAP. Question 16. A client admitted for dehydration is confused and attempting to remove their intravenous 4-line. The LPN applies soft wrist restraints as prescribed by the healthcare provider. What is the LPN's next most important coordinated care action? A. Document the application of restraints and the client's behavior. B. Ensure the client's call light is within reach. C. Assess the client's skin integrity and circulation at the restraint sites. D. Notify the client's family about the use of restraints. Answer: C. Assess the client's skin integrity and circulation at the restraint sites. This question focuses on patient safety and continuous assessment when restraints are used, a critical aspect of coordinated care. While all options are important, the keywords next most important after applying restraints highlight the immediate need to ensure client safety and prevent injury. Regular assessment of skin integrity and circulation distal to the restraint sites is paramount to prevent complications such as nerve damage, impaired circulation, or pressure injuries. This immediate assessment takes precedence over other actions, although all are necessary for comprehensive care. Question 17. An LPN is providing care for a client who is terminally ill and receiving hospice care at home. The client's daughter expresses concern that her mother is not eating enough and wants to force-feed her. What is the LPN's best response regarding coordinated care? A. It's important that your mother maintains her strength, so encourage her to eat. B. In the final stages of life, it's common for appetite to decrease, and force-feeding can cause discomfort. C. I will ask the hospice social worker to speak with you about grief counseling. D. You should consult with the healthcare provider about supplemental nutrition. Answer: B. In the final stages of life, it's common for appetite to decrease, and force feeding can cause discomfort. This question tests the LPN's understanding of end-of-life care principles and effective communication with families within the coordinated care model. The keywords terminally ill, hospice care, and not eating enough indicate that the client is likely experiencing natural physiological changes at the end of life. The best response is to provide accurate, empathetic education that addresses the daughter's concern by explaining that decreased appetite is normal and that forcing food can cause discomfort, emphasizing comfort over nutrition in this context. This helps the family understand the dying process and aligns with hospice philosophy. Question 18. A client has been diagnosed with a highly contagious respiratory infection. The LPN is preparing to enter the client's room. Which action demonstrates adherence to infection control principles in coordinated care? A. Donning a surgical mask, gown, and gloves before entering the room. B. Wearing an N95 respirator, gown, gloves, and eye protection before entering the room. C. Wearing standard procedure gloves and a disposable gown. D. Washing hands thoroughly before and after leaving the room. Answer: B. Wearing an N95 respirator, gown, gloves, and eye protection before entering the room. This question assesses the LPN's knowledge of infection control, specifically airborne precautions, which is a critical aspect of coordinated care and patient safety. The keyword highly contagious respiratory infection strongly suggests the need for airborne precautions, which require an N95 respirator, along with contact precautions, gown, gloves, and eye protection. Choosing the correct personal protective equipment, PPE, for the specific mode of transmission is essential to protect both the healthcare worker and prevent the spread of infection to other clients. Question 19. An LPN is assisting with the admission of a client from a nursing home. The client's medical record is incomplete, missing recent medication reconciliation and vital signs. What is the LPN's most appropriate action to ensure coordinated care? A. Document the incomplete record and proceed with the admission process. B. Call the nursing home to obtain the missing information immediately. C. Ask the client's family if they can provide the missing information. D. Inform the charge nurse about the incomplete medical record. Answer: D. Inform the charge nurse about the incomplete medical record. This question highlights the LPN's role in ensuring accurate information transfer and professional communication within coordinated care. The keywords incomplete medical record, missing recent medication reconciliation, and vital signs indicate a potential safety risk. While gathering information is crucial, the LPN should inform the charge nurse. The charge nurse, as the unit leader, can then oversee the process, delegate tasks as appropriate, and ensure that a comprehensive and accurate medical record is obtained, which is vital for safe patient care and medication administration upon admission. Question 20. An LPN is caring for a client with a new peripherally inserted central catheter, PICC, line. The client reports moderate pain at the insertion site. The LPN notes slight redness but no swelling or drainage. What is the LPN's most appropriate action? A. Apply a warm compress to the site. B. Administer a prescribed PRN analgesic for pain relief. C. Document the findings and continue to monitor the site. D. Notify the registered nurse, RN, immediately. Answer: D. Notify the registered nurse, RN, immediately. This question tests the LPN's understanding of their scope of practice and the need for escalation in coordinated care when potential complications arise. The keywords PICC line, moderate pain, and slight redness indicate potential early signs of phlebitis or infection, which can lead to serious complications. Although an LPN can monitor and document, assessing the severity and managing potential complications of a central line is typically within the RN's scope, especially concerning a new line. Notifying the RN ensures a timely, comprehensive assessment and appropriate intervention to prevent further complications. Question 21. An LPN is preparing a client for discharge home with a new prescription for warfarin. The client has limited literacy skills and appears overwhelmed by the medication instructions. What is the LPN's best action in coordinating care? A. Provide written instructions and instruct the client to have a family member read them. B. Teach the client about the medication using simple language and visual aids, and verify understanding through a return demonstration. C. Advise the client to call the pharmacy if they have any questions about the medication. D. Request the healthcare provider change the medication to one that does not require close monitoring. Answer: B. Teach the client about the medication using simple language and visual aids, and verify understanding through a return demonstration. This question addresses the LPN's role in patient education and adapting teaching methods within coordinated care. The keywords limited literacy skills and appears overwhelmed highlight a barrier to learning. The best action is to adjust the teaching approach to meet the client's needs. Using simple language, visual aids, and return demonstration, teach-back method, is an effective strategy to ensure understanding, regardless of literacy level, promoting safe medication management at home. This directly supports the client's ability to self-manage their care. Question 22. A client on a medical surgical unit is experiencing sudden onset of shortness of breath and chest pain. The LPN is the only licensed nurse immediately available. What is the LPN's first action? A. Apply oxygen via nasal cannula. B. Call a rapid response team or emergency code. C. Assess the client's vital signs and level of consciousness. D. Notify the registered nurse, RN, and healthcare provider. Answer: C. Assess the client's vital signs and level of consciousness. This question tests the LPN's prioritization and critical thinking in an emergent situation within coordinated care. The keywords sudden onset of shortness of breath and chest pain indicate a potentially life-threatening event. While oxygen may be needed and emergency activation is crucial, the first action must always be a quick, focused assessment of the client's ABCs, airway, breathing, circulation, and neurological status by checking vital signs and level of consciousness. This immediate assessment provides essential information to guide subsequent interventions and determine the appropriate level of emergency response. Question 23. An LPN identifies a potential medication error made by another LPN on the previous shift. The client appears unharmed. What is the most appropriate action for the LPN to take? A. Correct the error and continue with client care. B. Document the error in the client's chart and notify the healthcare provider. C. Discuss the error directly with the LPN who made it. D. Report the medication error to the charge nurse or supervisor according to facility policy. Answer: D. Report the medication error to the charge nurse or supervisor according to facility policy. This question addresses the LPN's role in quality improvement and professional accountability within coordinated care. The keywords potential medication error and client appears unharmed still necessitate proper reporting. The most appropriate action is to follow the chain of command and report the error to the charge nurse or supervisor. This ensures that the incident is formally documented, investigated, and reviewed as part of the facility's quality improvement process, even if no apparent harm occurred, helping to prevent future errors and maintain patient safety. Question 24. A client with a long history of chronic pain is admitted. The LPN notes the client frequently requests pain medication, sometimes before the next dose is due. What is the LPN's most appropriate action to coordinate pain management? A. Administer the pain medication only when it is due, explaining the schedule to the client. B. Document the client's frequent requests and notify the healthcare provider to evaluate the pain regimen. C. Suggest non-pharmacological pain relief methods such as distraction or repositioning. D. Inform the client that they are requesting too much pain medication. Answer: B. Document the client's frequent requests and notify the healthcare provider to evaluate the pain regimen. This question tests the LPN's role in advocating for effective pain management and collaborating with the healthcare provider in coordinated care. The keywords "frequently requests pain medication," sometimes before the next dose is due, indicate that the current pain management plan may be inadequate. While the LPN cannot independently change the medication schedule, documenting the requests and notifying the healthcare provider allows for a comprehensive assessment of the client's pain and a potential adjustment to the medication regimen or exploration of other pain management strategies. This ensures the client's pain is effectively managed. Question 25. An LPN is caring for an older adult client who frequently calls for assistance with tasks they are capable of performing independently, such as reaching for the water pitcher. Which action by the LPN best promotes client independence and efficient use of resources in coordinated care? A. Remind the client to try to do it themselves before calling for help. B. Provide the requested assistance quickly to avoid client frustration. C. Place the water pitcher and other frequently used items within the client's easy reach. D. Document the client's frequent calls and discuss it with the nursing assistant. Answer: C. Place the water pitcher and other frequently used items within the client's easy reach. This question focuses on resource management and promoting client independence within coordinated care. The keywords "frequently calls for assistance with tasks they are capable of performing independently" suggest a need for environmental modification. Placing frequently used items within the client's easy reach directly empowers them to perform tasks independently, reducing their reliance on staff, improving their autonomy, and optimizing nursing time. This simple intervention demonstrates proactive care planning and resourcefulness. Question 26. An LPN is teaching a client about a new colostomy. The client's spouse consistently answers questions directed at the client and expresses doubt about the client's ability to manage the colostomy independently. What is the LPN's most appropriate response to facilitate coordinated care and client autonomy? A. Redirect the spouse gently, stating, "I'd like to hear from your spouse directly about their understanding." B. Continue teaching, focusing on the spouse as the primary learner. C. Document the spouse's behavior and address it with the primary RN. D. Ask the spouse to step out of the room so the client can focus. Answer: A. Redirect the spouse gently, stating, "I'd like to hear from your spouse directly about their understanding." This question tests the LPN's communication skills and ability to promote client autonomy within coordinated care, even when family members are overly involved. The keywords "spouse consistently answers questions directed at the client" and "expresses doubt about the client's ability" indicate a need to recenter the client as the primary learner and decision-maker. Gently redirecting the spouse back to the client empowers the client, respects their autonomy, and ensures that the teaching is truly absorbed by the individual who will be managing their own care. Question 27. An LPN is preparing a client for discharge. The client lives alone and expresses concern about affordability of prescribed medications. What is the LPN's most appropriate action to ensure coordinated care? A. Advise the client to use generic medications if possible. B. Tell the client to discuss concerns with their pharmacy. C. Notify the social worker or case manager about the client's financial concerns. D. Provide the client with a list of free medication samples. Answer C. Notify the social worker or case manager about the client's financial concerns. This question focuses on comprehensive discharge planning and identifying appropriate referrals within coordinated care. The keywords lives alone and affordability of prescribed medications highlight a significant barrier to adherence and successful discharge. The most appropriate action is to refer to a social worker or case manager, as they are equipped to connect clients with financial assistance programs, prescription assistance programs, or community resources. This ensures the client can access necessary medications and promotes continuity of care post-discharge. Question 28. A client requests to review their medical record. The LPN knows that the chart contains sensitive information. What is the LPN's most appropriate response? A. I can show you parts of your record, but some information is restricted. B. You need to ask your healthcare provider for permission to view your chart. C. Clients have the right to access their medical records. I will facilitate that request through the appropriate channels. D. You can only view your record once you are discharged from the hospital. Answer C. Clients have the right to access their medical records. I will facilitate that request through the appropriate channels. This question tests the LPN's knowledge of patient rights, specifically regarding access to medical records, within coordinated care. The core concept is respecting client autonomy and legal rights. Clients have a legal right to access their medical records under HIPAA. The LPN's role is to affirm this right and facilitate the request according to facility policy, which usually involves a formal process rather than direct access from the LPN or healthcare provider permission. This ensures transparency and patient empowerment. Question 29. The LPN is preparing to administer medications to a client who suddenly becomes confused and disoriented. The client attempts to pull out their 4. What is the LPN's most immediate safety action? A. Administer the prescribed medications quickly. B. Attempt to reorient the client verbally. C. Secure the foresight and call for assistance from another staff member. D. Administer a PRN sedative if available and prescribed. Answer C. Secure the foresight and call for assistance from another staff member. This question assesses the LPN's immediate safety prioritization in a dynamic coordinated care situation. The keywords suddenly becomes confused and disoriented and attempts to pull out their 4 indicate an immediate threat to the client's safety and integrity of the 4 access. The most immediate action is to secure the foresight to prevent injury and loss of access, and then call for assistance. This ensures the client's immediate physical safety and allows for a coordinated response to manage the confusion and disorientation effectively. Question 30. An LPN is tasked with supervising an unlicensed assistive personnel, UAP, who is new to the unit. The UAP is consistently performing tasks slowly and seems unsure of unit routines. What is the LPN's best action in coordinating care and supporting the UAP? A. Report the UAP's performance to the charge nurse for disciplinary action. B. Continue to delegate tasks, expecting the UAP to improve with time. C. Provide constructive feedback, offer to demonstrate tasks, and answer questions. D. Reassign all complex tasks to another, more experienced UAP. Answer C. Provide constructive feedback, offer to demonstrate tasks, and answer questions. This question tests the LPN's role in supervision, mentorship, and effective team communication within coordinated care. The keywords new to the unit, performing tasks slowly, and unsure of unit routines suggest a need for support and education rather than discipline or avoidance. The best action is to actively provide constructive feedback, demonstrate correct procedures, and be available to answer questions. This supportive approach helps the UAP gain confidence and competence, ultimately improving the efficiency and quality of care delivered by the team.